Okay, everybody, this is the second lecture in our series about health insurance and thinking about just really some of the basics of how it works. So first, you should have watched kind of the first episode talking about Medicaid and Medicare as government-sponsored healthcare programs. Here I'm going to do a very quick overview of universal health insurance, kind of looking at what it might look like in general, and then what it looks like in other countries. We'll use Canada as our example. I also want to give a shout out to Dr. Saltzman from the Economics and Management departments. So he has given a long lecture on this in the past, which has really been helpful. But with some of our changes this year, he is not able to do it. And so some of the slides that I'm using and stories that I'm using are his. So to start us off here, we're going to talk about what does universal health care kind of look like worldwide. This is actually a map from Wikipedia. Of all places, but it has a really nice kind of just quick overview of what it looks like. So the countries in blue have primarily single-payer, fully government-funded healthcare programs. The countries in the dark green have universal healthcare programs, although there are other facets of them. The U.S. is kind of this neon green color because we have large government-funded programs, Medicare and Medicaid, like I talked about before, which combined cover about 130 or so million people. So a good portion of our country is covered by those government-funded programs. But then we also have a high reliance on private health insurance, which is what I was just saying, right? So I think that most folks, when they think about the U.S., they immediately jump to the private sector health insurance story, but really the U.S. is that combination of public and private. The private being employer-sponsored plans, where you go to work at a company as a benefit, right? So of your job, so they give you a salary and a benefit. They allow you to get into their employer-sponsored plan. The idea with those employer-sponsored plans is by getting a large collection of individuals, you can lower the cost, lower the risk for the entire group. And so there's a cost savings mechanism in there. That is different from individual plans. So let's say that you don't work at a company, maybe you own your own small business or something. In those cases, you have to buy individual plans. You're not in a larger group by the same way as the employer-sponsored plans. And thus, in many cases, the individual plans can be more expensive, but they also might have more flexibility. So an individual might be able to buy a high deductible plan that maybe has lower monthly premiums, but maybe might have more out-of-pocket costs should that individual get sick. So there's a little bit of risk in there. The health insurance exchanges that were created by the Affordable Care Act, or Obamacare, relies on private plans. So there are private plans that the government essentially is paying for through these health insurance exchanges. So as much as folks would criticize the Affordable Care Act, there was actually a big compromise in there to make those exchanges work, and not to eliminate private health insurance, but to utilize private health insurance to expand coverage to more Americans. There's a give and take there because it's also more expensive. The public plans in my other recorded lecture, I talked about Medicare and Medicaid. Again, they account for a significant portion of the population that gets their health insurance through those government-run programs. So overall, right, we're talking about health insurance and trying to get more folks access to care, right? Health insurance in the U.S. Has been a topic of conversation for over 100 years. This idea of universal health insurance was first advocated by Teddy Roosevelt there in the picture over 100 years ago. And over time, it really grew to be a major platform of the left. It really didn't take hold through the early 20th century. There are a number of bills that were put forth. President Truman proposed a national health insurance plan in the 1940s. It got some pretty wide support. However, of all folks, there's a massive lobbying campaign by the American Medical Association that helped to defeat that national universal health insurance plan from President Truman. And there was a great concern from the American Medical Association that a universal health care plan would result in decreased quality of care, certainly decreased compensation for physicians and for the healthcare system. And so they really sold the American public on defeating it. This is a 100% flip to what we see with the American Medical Association today, which advocates for greater access to care for patients. So overall, what is this idea of universal health insurance? All right, and this kind of goes back to some of this question from the previous lecture about health coverage being a right or a privilege. So a universal health insurance program is going to give health insurance coverage for all citizens. All right, and in doing so, they're really trying to increase health outcomes, like decrease risk and increase access to health services. All right. When we look at different plans, different countries, there's massive variation in terms of who is covered, which services are covered, and how much that individual ends up paying out of pocket anyways, right? So even if you have a universal health insurance program, many countries still have their citizens paying out of pocket expenses in addition to the taxes that pay for it, certainly, right? To also help cover those costs. So the single payer idea is a little bit different, right? And we only see this really in Canada and a few other major countries. This is a funny mechanism where the government pays for healthcare directly. All right, so this is a direct nationalized health program. All right, so the government directly pays hospitals, pays clinics. The citizens pay taxes to the government, which pools all that money together, right, and then pays it out. Right, so most countries are hybrid systems. Again, we have a single payer type model with like our Medicare system, right? But we again are pretty reliant on private health insurance, as are most European countries, although they have a lot bigger government funded portion than private healthcare. Canada is our example, so we're going to use Canada as an example of a single payer healthcare system. So again, taxes pay for the health insurance, right? And each province in Canada, right, administers it. So there's small differences between provinces within Canada. All right. So patients are not directly involved in the payment of basic medical care. No deductibles, and either no or very, very low co-insurance or co-pays, right? So that means like that portion you'd pay for going to the hospital, for going to the doctor. There are private plans, so there is a market for private supplemental insurance that could be an individual can go and buy in Canada to supplement the state-run program, or in some cases, employers actually sponsor some of these supplemental plans. There's always this controversy, so we know that Canadians like hockey, for my hockey joke, but they also overwhelmingly support their system, right? They are happy, and this is surveyed a lot, so this is medical literature, not my opinion, that they are happy to support an increase in access of care, right? So now they have a culture in Canada now that sees that if by supporting everyone's healthcare access, the whole country wins, right? So voters in Canada are overwhelmingly supportive of using taxes to pay for healthcare access for everyone, right? And that theme is that by raising that standard of healthcare for everyone, you're also raising the quality of care. So there's a lot of positives with that. Some of the issues that come up in the Canadian system are some wait times for specialties, right? So there's a lot more focus on primary care. Primary care is shown with economic data to really increase outcomes and decrease costs for the system. That's true in the US, Canada, Britain, European countries, right? So by having more primary care, there's then going to be likely a longer wait time for specialties because there's less of them, right? So, here, I know in my house, my wife's a specialist, my wife's a neurologist. People expect to see their neurologist like the next day, the next week, right? Even if it's not an urgent emergency situation, right? And so there is some of that pushback there, and that issue there with specialty coverage in Canada. There's also limited in differential coverage for other aspects of the healthcare system, whether it's mental health care coverage, vision, dental, chiropractic, etc. Depending on the situation and the diagnosis, it may or may not be covered by the Canadian healthcare system. And that's why, in part, that some of these supplemental plans exist. So on that last point maybe I should make is that, again, these are very complicated systems, whether it's the US, whether it's Canada, whether I chose Britain to look at here, right? So I'm just kind of giving you a brief look at stuff to kind of like seed some of that thought about how does health insurance work, and what are some of these kind of big ideas when folks talk about a single payer system, a Medicare for all type system for the US, etc. The one thing that we know for sure that the US sucks at is that we pay a lot of money and we don't get the best outcomes. There are numerous studies out there. This is a nice one, nice quick graph here showing healthcare costs as a percent of GDP, percent of gross domestic product, which is a key measure that economists use to compare countries. And essentially, in our case, can show us how fast our healthcare costs have been rising. So if we go back to 1970 and we're comparing the US, the United Kingdom, Germany, Switzerland, Canada, Austria, and right, most of the percent GDP in 1970 is around 4 to 6%. So it's a pretty tight range there. And as we fast forward towards more recent times, we see the US become an outlier like in the 90s and kind of keep rising up. All right, there's a bit of a plateau that we start to hit with implementation of the Affordable Care Act. One of the goals of the Affordable Care Act was to reduce costs. It has done that somewhat, but there's still, even with the Affordable Care Act, our healthcare costs are still increasing at a higher rate as these other countries. So overall, right, we spend much more on healthcare than Canada does, although Canada is able to provide healthcare for all their citizens, whereas in the US, as we saw in my previous lecture, there's 8-9% of US citizens that don't have any healthcare coverage at all. And our out-of-pocket expenses for individuals in the US are much, much higher than these other countries. Right? So there's this big, big issue here that we spend a ton of money on it and we don't get as good outcomes as the other countries. Right? So whether or not your politics or your policies involve Medicare for all or other aspects of healthcare reform, right? One thing that's true and that should unite our politicians is that we spend a lot of money on it and we don't get what we pay for, right? So I don't have the answers here, right, in the next 2 minutes of this lecture, but it's something to think about as we think about how can we increase access, increase coverage for individuals, and at the same time bring down those costs so we don't have those surprise bills when we go to the ER or have an emergency type surgery done or something, and you're popped with that $6,000, that $12,000 bill. I'm sure y'all have seen some of those stories out there. If you haven't, NPR does a great series on the hidden costs of healthcare, where they profile real people, real Americans, when they get some of their healthcare bills and to see the differences that exist in some of the costs that we never know are coming until that bill arrives in your mailbox. It's very real for $10,000, $20,000, $30,000 or more. All right, so that's my last point to think about here, right, is we talked about now Medicare, Medicaid, universal health coverage. I'm asking you to consider about healthcare as a right versus a privilege. We're looking at healthcare costs on this. So I kind of wanted you to summarize some of those ideas, think about your experience, reflect on all that for our last reflection of the course.